Good evening and welcome to our special segment on a developing health situation in China. As the world continues to recover from the devastating impact of the COVID-19 pandemic, a new viral outbreak has emerged, sparking global concern. The outbreak is caused by a virus known as human metapneumovirus or Hmpv, and it's drawing attention due to its striking similarities to COVID-19. Let's take a closer look at what Hmpv is, how it compares to COVID-19, and what we know about its potential impact. What is human metapneumovirus? Human metapneumovirus is a respiratory virus that was first identified in the Netherlands in 2001. It is part of the Paramoxilviridae family, which includes other respiratory viruses like the respiratory syncytial virus and even the measles virus. Hmpv primarily affects the upper and lower respiratory tracts and is most dangerous for children, the elderly, and individuals with weakened immune system. Just like COVID-19, Hmpv spreads through respiratory droplets, which are increased when an infected person coughs or sneezes. It can also be transmitted through contact with contaminated surfaces, making it highly contagious in crowded places like schools, hospitals, and homes. Symptoms of Hmpv. Now let's talk about the symptoms. Hmpv symptoms closely mirror those of other respiratory infections, including the flu and COVID-19. The most common symptoms include fever, cough, shortness of breath, wheezing, sore throat, runny nose, fatigue, body aches. For most people, the illness presents as a mild to moderate cold. However, for vulnerable groups, it can lead to serious respiratory conditions like pneumonia or bronchitis, which may require hospitalization. In extreme cases, it can be life-threatening. Hmpv versus COVID-19, similarities and differences. Given that Hmpv is gaining attention during the aftermath of the COVID-19 pandemic, many are wondering how the two viruses compare. Let's break it down. Causative agent. While COVID-19 is caused by the SARS-CoV-2 virus, Hmpv is caused by a paramoxyvirus. These viruses belong to different families, but they share some similarities in terms of transmission and symptoms. Severity. While both viruses can lead to severe respiratory problems, COVID-19 has proven to be more deadly, particularly in its early waves. Hmpv, on the other hand, typically causes less severe outcomes, though it remains a concern for high-risk groups. Vaccine availability. One key difference is the availability of vaccines. COVID-19 vaccines have been developed and distributed globally, proving crucial in controlling its spread. Unfortunately, there is no specific vaccine for Hmpv at this time, though research is ongoing. Pandemic potential. Although Hmpv is concerning, it has not demonstrated the same global disruption potential as COVID-19. It has not spread to the same extent, nor does it seem to have the same long-lasting societal impact. What we know about the Hmpv outbreak in China. As of now, China is facing a notable outbreak of Hmpv, especially during the winter months, when respiratory infections tend to spread more easily. The country has seen a rise in hospitalizations, with many individuals exhibiting symptoms similar to those of COVID-19. Authorities are ramping up efforts to control the spread, focusing on high-risk population such as the elderly and children, who are more susceptible to the virus. However, despite the similarities to COVID-19, the overall impact of the outbreak is still being closely monitored. Current vaccines and treatment option. At present, There is no specific vaccines for Hmpv. The virus is managed through supportive care such as pain relievers, fever reducers, and fluids to prevent dehydration. In more severe cases, patients may require oxygen therapy or even mechanical ventilation. Although no vaccines is available yet, researchers are working on potential solutions, but it may take time to develop an effective treatment or preventive measures. Preventions. In the meantime, basic prevention measures are the best way to reduce the spread of Hmpv. These include practicing good hand hygiene, avoiding close contact with infected individuals, wearing masks in crowded areas. While the Hmpv outbreak in China is concerning, it is not the global threat that COVID-19 was. The virus, while causing symptoms similar to other respiratory infections, is not as lethal and does not have the same pandemic potential. There is no vaccine for Hmpv as of now, but with proper medical care, the virus can be managed and its spread can be controlled. Authorities are monitoring the situation closely, and we must continue to follow public health guidelines to stay safe. That's all for our special segment on the Hmpv outbreak. Stay tuned for more updates, and remember, taking simple preventive measures can go a long way in protecting ourselves and others from viral infection. Stay safe.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube, and Twitter.